Some myths that are out there when it comes to trans men and fertility is that there's a lot of myths about trans men being infertile if they start testosterone, or that they can't get pregnant. But those are definitely false, because testosterone is not a birth control. There is definitely birth control that is possible to be on while you're on testosterone that will not affect your transition or your hormone levels. That would be a copper IUD. That's the most recommended one that I have been recommended by my doctors. Also, there is a daily pill that you can take that's also birth control, and it does not have estrogen in it. So you could definitely, take birth control still. If you would like a birth control that does not interfere with your testosterone, you could talk to your doctor about providing you that prescription. I still have not had my hysterectomy, so it is possible for me still to get pregnant. So definitely being aware that you should be you should be on birth control if you do not plan on getting pregnant. That is definitely something that all trans men should know. Unfortunately, that's not something that a lot of trans men in our community know about. I do have this conversation a lot locally here in Texas where I live. There's a lot of information on repro health that trans folks don't get to learn about. Our education system does not teach people about ways to prevent a pregnancy, right? There are definitely a lot of different ways in which you can get prescribed birth control. You can talk to your primary care doctor, you can talk to your OB-GYN if you're comfortable with the OB-GYN that you're with. If you are part of the FOLX health community, then you could definitely talk to your FOLX provider and ask them about the options for you in case you want to get on birth control. Another myth that is out there is when it comes to trans men that are injectable testosterone, that some trans men think that because they have just taken their shot that week that they are not able to get pregnant. That is false.